When you say, "I know first aid," you're doing more than just offering help. You're telling the victim that you have the knowledge and the skills to provide professional first aid care.
First aid emergencies include injuries such as cuts or broken bones and sudden illnesses such as a diabetic emergency or stroke.
Care for first aid emergencies includes bandaging wounds, splinting muscle, bone, and joint injuries, and taking appropriate action for a variety of sudden illnesses.
Any number of first aid emergencies can occur at your facility, and as always, you must be prepared to respond.
Excuse me, my daughter hurt her leg. Is there someone here who can help her?
When you recognize a possible injury or illness, activate your facility's emergency action plan. Let your team know you're responding. Size up the scene as you approach the victim. Determine if the scene is safe, what might have happened, how many victims are involved, and if any bystanders can help.
Hi, Erin. I'm Meredith. Are you okay?
My leg hurts.
Okay. Is it all right if I help you?
Put on the appropriate personal protective equipment.
She said she was feeling dizzy.
Dizzy?
Yeah.
Okay.
I'd like to call her dad and see if he can come pick us up.
We have a phone in the office that you're welcome to use.
Perform an initial assessment to determine if there are any life-threatening conditions.
All right, can you tell me what happened?
I was climbing out of the pool on the ladder and I was feeling dizzy and I slipped and I hurt my leg on the step.
All right. I'm gonna go ahead and take a look at that. It's not bleeding too badly. So we're gonna put this on top and you can hold it on there like that.
Once you determine that the victim is conscious and breathing and has no life-threatening conditions, perform a secondary assessment to learn more about the victim's condition. Use the SAMPLE method to get a brief history. SAMPLE stands for S, signs and symptoms, A, allergies, M, medications, P, pertinent past medical history, L, last oral intake, E, events leading up to the incident. Interview the victim or bystanders to get the information you need. For a child or infant, you may need to interview the parent or guardian to gather the information.
Okay, good. So, does anything else hurt?
No.
No? All right. I'm gonna ask you a few questions, and if anything starts hurting, you can go ahead and tell me, okay? Do you have any allergies?
No.
Do you take any medication?
No.
Okay. Have you gone to the doctor for anything recently?
No.
No. Have you eaten anything today?
Yeah, I had a few French fries for lunch.
Okay. Can you tell me what happened before you scraped your leg?
I was diving for a penny and I decided to get out and get a drink of water and I felt dizzy and I slipped.
Did you pass out?
No.
Okay.
If the person is an adult, do a visual head-to-toe examination. Begin at the top of the head and work your way down.
However, for a child, do a toe-to-head examination. Start your exam at the toes and work your way up to the head. This can be less threatening and lets the child watch and take part. Position yourself in front of the child at eye level. As you examine the child, look for any obvious deformities or other signs of injury. Be calm and reassuring, and do not separate a child or infant from a parent or guardian unless absolutely necessary.
I'm gonna ask you to move a little bit for me, and if anything hurts, go ahead and tell me, okay? All right, can you wiggle your toes and your feet? Okay, good. Can you move that leg for me? All right, we'll let that one rest. Can you wiggle this hand and move your arm?
As you continue, watch for changes in consciousness and breathing. To check the chest, ask the victim to take a deep breath, then blow the air out. Listen for difficulty or changes in breathing.
Can you take a deep breath? Blow out.
Work your way up the rest of the body. Ask the victim to shrug her shoulders.
Now, can you shrug your shoulders like this? Good. Now, can you move your head side to side? Good.
Finally, look at the face, ears, nose, and mouth. Note the coloring of the face and lips. Look at the skin. Is it moist or dry? Pale or flushed?
Okay, good. I'm going to take a quick look at you. Okay, now I'm gonna take your temperature by putting the back of my hand on your forehead like this. Okay?
Once you've completed the secondary assessment, provide care for the conditions you find.
Okay.
Honey, Daddy will be here in a few minutes. How you doing?
Good.
I'd like to meet him and show him where we are. Is that all right?
Yeah, it's fine. We'll just be a couple more minutes.
Okay, great. I'll be right back.
Okay. So
Have the victim rest in a comfortable position until she is well enough to leave, or until advanced medical personnel arrive and take over. Be sure to share the information about the victim's condition with the EMS personnel. This is especially important if the victim becomes unresponsive before they arrive.
In review, to perform a secondary assessment, interview the victim using the sample method. S, signs and symptoms. A, allergies. M, medications. P, pertinent past medical history. L, last oral intake. E, events leading up to the incident.
Do a visual head-to-toe examination for an adult and a toe-to-head for a child. Look for any obvious deformities or other signs of injury, and provide care for the conditions you find.